Hi, good afternoon, Professor. My name is Lisette Campos Cuevas, and I will be presenting my signature assignment. So to start off, why I chose this patient was because as soon as I saw his complaint, I immediately started to think about different scenarios and different diagnoses that could be present, or what to look for, or what to ask. So I thought that was very interesting. I'm going to go ahead and explain the case to you. This is RM, and he is a 17-year-old boy, Hispanic. Yeah, he presented to the office with his mother, which both appeared to be reliable historians. The mother seemed to be asking most of the answers, but he tends to answer some of the questions too. So the chief complaint was the mother stated she brought her son to the office for pain in the left neck and the left inguinal area. This is where I was like, okay. So my mind immediately started thinking of different diagnoses. Obviously, the most common, which is like a muscle strain, and then I started to progress into, well, what about any lymphadenopathy? So any swelling of the lymph nodes, and then, well, the inguinal area, you can kind of inguinal hernia. Then I started to think like different types of scenarios. So I'm going to go ahead and get to the HPI. So RM is a 17-year-old male, Hispanic descent, that presents with his mother to the office. The mother stated her son started having left inguinal pain, complaining of a 7 out of 10 pain that started about a week ago. Patient states that the pain does come and go and is usually worse after football practice. So he is a football player. So then that's kind of started throwing me back into, well, maybe he got hurt or something like that. So those are the things that were going through my mind. Patient's mother state that she has been having him on ibuprofen, 600 milligrams when needed. Some days it helps and some days it doesn't. Patient also denies any radiation of pain, no pain with urination. Patient denies any injuries to the area. Patient states he had this pain before, about a year ago, but it resolved within 2 to 3 weeks without treatment. For the patient's left neck pain, the mother states that it started about 3 days ago and it has been getting worse. Patient rates the neck pain at 5 out of 10 and is usually in the morning and during practice. Patient denies any injury to the neck. Patient does use the ibuprofen, but it doesn't seem to help a lot. He states that he occasionally felt this pain within the last year, and patient states both pains feel like a sharp and pulling of sensation. So in the past medical history, he doesn't have any medical history. Pretty much it's unremarkable. The mother states there's no hospitalizations, no surgery. The only pain medication he's taking is the ibuprofen. The mother denies taking any vitamins or supplements. The patient does not have any allergies to any medication or any seasonal allergies either. For the family history, pretty much the mom is pretty healthy. The father just has hypertension, but patient does not have any siblings. The maternal grandmother has hyperlipidemia, and the paternal grandmother has history of breast cancer. The grandparents, one of them is deceased at 62 of unknown causes, and the other one is healthy. So for his social history, this was really important, really, because we want to get to know, like, was there any previous injury, what's going on. Sometimes boys can be kind of rough play, so you have to focus really on the social history and like make sure that there's nothing there. So he is a senior in high school. He lives with both parents in a single family home. He does play football in his local high school, but denies any recent trauma, any injury. He denies any use of alcohol, drugs, vaping, or tobacco use. He denies any anxiety, depression, or any bullying at school. That's something really important too, because he may not be stating that he's being bullied, and maybe sometimes even other kids can be hurting him, like maybe at practice, or like bullying him, and he can be being physically assaulted or something like that. That can cause these types of pains too. Patient is very active in school, usually plays football during the fall and baseball during the spring, and the mother denies bad eating habits. So the patient seems very well off. He's sitting, talking, very, very healthy. So for the review of system, the mother denies any fever, chills, night sweats, fatigues, weight loss, nothing like that. No cardiovascular problems, no respiratory problems, no gastrointestinal such as abdominal pain, nausea, vomiting, no bowel changes in bowel movement. I did ask about, because of the inguinal pain, sometimes it can be confused with abdominal pain. Sometimes, make sure that there's no like UTI symptoms. And he denies any pain or burning when you're in urination, no back pain. For musculoskeletal, the patient does complain of that pain, like the stiffness of the neck when he rotates. Patient complains the inguinal pain also with movement, even laying down. The patient denies any complaints of any swollen neck glands or any like swelling of the inguinal area. So for his vital signs, they're pretty stable. The pulse is 74, the blood pressure is 102/74, respirations are 20, temperature is 98, the O2 on room air is 100, and his pain level, right at this time, it was 5 out of 10. The patient is 5'10", 165 pounds, which makes his BMI 23.7. So for physical assessment, the patient is well-developed, 17-year-old. He's alert-oriented, no signs of distress. For the heart, there's no heaves, no leaves noted, S1 and S2 auscultated on all auscultation points. No S3 or S4 noted, no gallops or murmurs. The respiratory, the chest has symmetrical expansion, no difficulty breathing, bilateral clear breath sounds without adventitious breath sounds. On auscultation, the bowel sounds are present, no pain or tenderness upon palpation to the abdomen or the inguinal area. For gastrointestinal, the only thing that we did was a CVA to check for CVA tenderness, and there was no tenderness. For the lymphatic system, we went ahead and we checked the neck, the cervical, the inguinal nodes, and there was no tenderness upon palpation and no lymphadenopathy noted. For the musculoskeletal, the patient does have some limited range of motion to the head with hyperextension and flexion and rotation to the left side of the neck. He does have limited left leg movement when movement and pain with flexion and extension of the leg. So for the diagnosis, a lot of things were going through my mind, but obviously with the assessment and all that, we can rule out different things. So we went ahead and ruled in muscle strain due to inguinal and neck pain with limited range of motion to both areas, usually after exercise. So the patient is an active sport player, so that's very common. Lymphadenopathy was ruled out. The pain and tenderness in the left neck, and upon movement and there's no tenderness or any swelling upon palpation of the lymph nodes. Inguinal hernia. Well, inguinal hernia. He's had that inguinal pain for the last week. So upon palpation, there was no noted swelling or anything, and then we asked him to do the Valsa maneuver, which there was no noted masses, but we still have to rule it out because it can be very dangerous. Another thing that could happen sometimes with that inguinal pain is testicular torsion. So using Jane Watson's theory, it's very important to ask patients and to build rapport with the patient to be able to ask questions about testicular area, especially when they're 17. It's very important. They can be very apprehensive about those questions. So there was questions about like, okay, are your testicles down? Remember, they're supposed to be down in the driveway and up in the garage, kind of like talk to them more in a friendly manner to be able to get a proper response. But his testicles, he stated that his testicles were distended. There's no no recent hits or anything to that area. So no trauma to that area. So for my diagnosis is muscle strained, and we ruled it in due to the ankle and neck pain with a limited range of motion, usually after exercise. And the patient is an active sport player, so it's very common to have these. So for diagnostics, so muscle injury is usually done by physical assessment, review of systems, and physical exam. The pain usually increases within the first few days, and they are usually relieved. The range of motion is usually decreased. So to completely rule out a hernia or a testicular torsion, we must order an ultrasound. It's very important to order this just to rule out. You don't want to bypass this and then something happening worse for this patient. We can do a CBC just to make sure there's no infection or anything like that. So pretty much the plan is to use the RICE method: rest, ice, compress, and elevate. Use ibuprofen to decrease the pain and inflammation, and continue to monitor the symptoms. If they persist past 5 days and they get worse, he needs to return to the clinic for evaluation. So education, we have to educate the patient about the RICE method, incorporate stretchings before football, using pain management for the relief of pain and decrease the inflammation. Educate the patient about the use of hot and cold compress, and incorporate Epsom salts to help the muscles relax. Pretty much for this patient, even though it seems like it's an easier patient, but I really enjoyed it because it just kind of opened up my mind into like so many different diagnoses that could be with something so simple. But at the end, we ended up deciding it was something a little bit more simple. I do have a clinical day on Thursday, so I wish maybe I can look up the results and see if there was anything else. But as of right now, that's a diagnosis. Thank you very much. Like I said, it was an easy case, but I thought it was very interesting because I was able to like expand my knowledge and kind of explore different ideas, kind of like talk to the patient, make sure we're using those proper caring tools, make those teenagers feel comfortable with us. So that was a pretty good case. Thank you very much. And that's the end of my case. And I'll post the references of everything in the chat box. Thank you.